Welcome back to Meds Made Easy. My name is Tarun. Today let's talk about Rizatriptan, also known as Maxalt. It is used for migraines. Okay, let's go through all the nitty-gritty of it. It is not used for prevention of migraines, okay? You take this medication when you actually have an active migraine going on right now. There are other medications to take for prevention of migraine, but you don't take this one as a preventative. When you full-blown have it, that's when you take this thing. Otherwise, it won't work if you take it as a preventative. It's a selective agonist for serotonin. Essentially, with all the, not going into all the nitty-gritty, whenever you have a migraine, it's because your meninges are inflamed, and they're pressing up against the rest of your skull, causing pain. That's what the migraine is. It's throbbing headaches, right? So what this does is it vasoconstricts. So it constricts all the blood vessels that are engorged, that are causing that inflammation, and it brings that swelling down. And hence why you get the relief. No more headaches. That's what hangovers are. That's what headaches are in general. That's just the best way to explain it, is all your blood vessels become inflamed due to whatever reason, injury, lack of fluids, kind of like when you get drunk and the next day you have a hangover and you have a headache with it. Same sort of thing. A lot of people have migraines due to like light sensitivity, things like that. All of those are triggers that cause that inflammation. So that's how it works. Now, I'm not going to go into the dosages, but generally you have 5 to 10 milligrams. You have ODTs, which are oral disintegrating tablets. Now, the tricky thing about these are if you take it and it doesn't work, you have to wait at least 2 hours with this medication, and then you could take another dose. And then after that, I'm not going to tell you you could take it again. That's really up to your doctor, but the clinical literature says that you can take a maximum of 30 milligrams in 24 hours. Now, should you? No. Consult your doctor about that. I can't legally tell you can, but if you take 5 milligrams, you can't just keep taking 5 milligrams 6 times a day until you hit the 30 milligram maximum dosage mark. That's not how this works. That 30 milligrams for 24 hours really kind of applies to that 10 milligram dosages. You really only re-up it maybe 1, maybe 2 times, and then you stop. If it doesn't work, you just got to go to a whole other medication. You just can't keep taking this one, because then each and every time that you take another dose, if your migraine isn't cured, you're increasing the chance of the adverse effects that you could feel on this medication. So preferably if one dosage can do it, that's what we want. But sometimes that doesn't always happen, so you have to watch out for that. The peak is 1 to 5 hours on a regular tablet of Maxalt. The oral disintegrating is 1.6 hours or 2.5 hours is the peak effect, meaning it'll kick in earlier than that, but the peak effect, the maximum effect, is usually felt at about that hour mark. So it comes on really, really quick, and then it leaves, because the whole point is to bring the swelling down, and once the swelling's down, it's good, and the medicine can then leave your body. Let's see here. It's a pregnancy class C, which means you have to weigh out the risks and benefits with your doctor. Lactation, the manufacturer has no information on whether you can take this if you are lactating or not. They literally leave it up to you to talk to your doctor about that. So that's kind of what I have to say too, is that's the official word, is talk to your doctor if you are lactating and you need to be on this medication. I'm going to put up a list of side effects here. The big ones that you're going to be looking for are like GI issues, stomach-related issues, upset stomach, things like that. Dizziness, sleepiness, fatigue, and then pressure sensation. Pressure sensation being is there sensitivity in different parts of your head while you're on the medication. Again, it's trying to bring down the inflammation. It's not going to be able to do that unilaterally across the board. It's probably going to work here a little bit, and then all the pain's going to move over here, and then the medicine takes its time to get over here. So it takes a little bit of time. So give it some time. You'll see pressure sensations. Because it's kind of a downer in that sense, I'm not going to call it a true downer. That's probably incorrect, but it does cause sleepiness, dizziness. You don't want to get in your car and just go drive off after a migraine. More than likely, if you have a migraine, you know that you can't do that stuff, right? If you are a sufferer of normal migraines or frequent migraines, you rather just, this medication is you take it and then you just want to lay down, on the couch, on the bed, and just relax and let the medication just do what it needs to do. You want to kind of dim out the lights and things like that, any kind of stimulants that could kind of make the migraine worse, right? Migraines are terrible, terrible things, and it just sucks. And I'm sorry if you get migraines, because that's just not cool. But hopefully this medication is great. Now, if this medication doesn't work for you, these kinds of triptans, or what they're called, you can take other ones because one is not similar to the other, even though they're in the same class. And this class of medications is really interesting because if Maxalt doesn't work, you can take Imitrex. Imitrex could very well work for you. A lot of times in the pharmacy world, when they all kind of have the same last names, they're cousins, which means they may not work as effectively, or they'll be very similar to each other. These ones are completely different. So give that a shot, see if it works. If this one doesn't work, there are a few other triptans you can try, and tell your doctor about it too. Say, hey, this one didn't work, let me try another one. But overall, very, very safe medication. Haven't seen too many issues on this. Actually, really haven't seen any issues on it at all. Price is really the kind of big thing, but in recent years, the cost of this medication has come down too. Insurance coverages have gotten better, so it is a very, very good medication to take. We advocate it to our patients all the time. So guys, if you have any questions, concerns, leave it down below in the comments. Let us know how we're doing. Give us a subscribe button, and we're just out here trying to help, guys. Thanks. Well, tuning in to Meds Made Easy. We'll see you next time. Bye.